everyone, it's Tuesday and you're watching Within the Frame. I'm Kim Bo-kyung. Today, October 10th, is World Mental Health Day, a day to raise awareness of mental health issues and to put efforts toward making sure that mental health care is a reality for people worldwide. Marking this day, Within the Frame aims to take a look at which mental disorders South Koreans are suffering from and if they are being properly treated. For more on this, we invite Chu Hee-yeon, Director of He Counseling and Coaching Center. Dr. Chu, welcome.
Thank you for having me.
Thank you for being with us. Now, we also have Professor Paul Youngbin Kim of Seattle Pacific University. Professor Kim, welcome.
Thank you for having me.
Thank you. Now, Dr. Chu, first question to you. So we regularly hear about mental health and how important it is, but often without an explanation of why it is so important. So could you tell us what exactly mental health means?
Sure. Mental health can be defined as a state of complete mental, physical, and social well-being. It extends beyond absence of mental disorders or mental illness, and mentally healthy states enables people to cope with daily stress, realize their potentials, learn and work well. Also, people can contribute to the community if they're mentally healthy. I would like to highlight a few points in this definition because it helps challenge common misconceptions about mental health. One is that mental health is interconnected with physical and social health. So suppressing mental health, you might think like, oh, I can still perform well at work and have a good social relationship, but in the long term, it's likely to be unsustainable. Probably many of you experience when you're under high stress, having headaches or these tensions in your muscles and such physical symptoms. Another point is that mental health is not just simple presence or absence of mental health disorders. It exists along a spectrum of wellness. So even if you are doing relatively well and don't have any depressive symptoms, you still can have a room for improving your mental health. Likewise, even if you're going through depressive symptoms, there's still room for you to bounce back in a healthy state and grow from that experience. Therefore, mental health matters to everyone.
That's so true. So that was the definition of the mental health. And now, Professor Kim, let's delve a little bit deeper into South Koreans' mental health. According to data from South Korea's National Health Insurance Service, the number of patients diagnosed with mental disorders increased by about 37%, from around 3.4 million in 2017 to 4.65 million last year. What's behind such an increase?
The time period that you mentioned includes the COVID-19 pandemic. So I would say that one big contributing factor might be the social isolation, the loneliness, and the constant anxiety that people felt during the pandemic. People were scared and people were lonely during this time. And so it's not surprising that during this time, mental illnesses and the rates of mental illnesses skyrocketed. I would say another contributing factor might be over the last several years, the knowledge of mental health has increased, and with that comes more sensitivity to the experiences of mental illness and potentially receiving the treatment that people need and also the diagnosis that they need. And therefore, the increase in mental health literacy might be another contributing factor to the rise in mental illness rates. Related to that, family doctors who might not have been previously willing or as ready to diagnose mental illnesses might now be more willing to do that. And therefore, that might also contribute to the increase in diagnosis and the rates of mental illnesses.
All right, I see. So the COVID-19 and public awareness of what mental health is could have been the reasons behind the increase. All right, well, Dr. Chu, let's tap into depression among the many mental disorders because the number of patients diagnosed with depression surpassed the 1 million mark in South Korea last year. Before we talk about the details, what are the symptoms of depression?
Typically, depressive symptoms include extended period of persistent low energy and low mood. This can be accompanied by experiencing intense sadness and hopelessness. Also, people tend to experience significant changes in appetite, such as low appetite or overeating. Also, sleep disturbances, loss in interest of activities that they once enjoyed. Also, what's serious is that sometimes depressive symptoms include thoughts of self-harm or suicide, which require immediate attention and support. Probably many listeners have experienced one or even more of these depressive symptoms at different degrees. And this is one of the factors that can actually be barriers to seeking professional help, because people think, oh, it's a normal emotional response to have this depressive symptoms, or it will pass by naturally over time. But in reality, these symptoms might be serious enough to require immediate attention from professionals. And diagnosing depression is not as simple as going through this checklist of depressive symptoms. Therefore, I recommend people to seek professional help. If you know someone who is going through these symptoms, also recommend them to seek for professional help for more accurate diagnosis and to be able to get early intervention, because early intervention can lead to also effective treatment.
Right, so it is really important to visit mental health clinics if anybody sees any of those symptoms that Dr. Chu has previously explained. Now, Professor Kim, interestingly, depression is particularly pronounced among women and the young population. Specifically, the number of women diagnosed was more than double of that of men, and by age group, those in their 20s were the highest. Could there be any specific reason for this?
Let me address the gender question first. One possibility might be from a social culture perspective and thinking specifically about gender inequality and how things like gender discrimination can be a constant stressor that might contribute to depressive symptoms. But I would like to also propose that another possibility or contributing factor is that the gender difference in depression rates might not be as great as they might appear. And I say that because research indicates that men compared to women might be less likely to seek help for something like depression. And therefore, they might be underdiagnosed when it comes to their experiences of depression. Related to that too, there's some research indicating that men and women might experience and express their depression differently based on gender expectations. So for example, sadness is what we typically think about when we think of depression. And research indicates that on average, women might present more with sadness symptoms when they are, for example, going to counseling for depression, whereas men might experience and express things like irritability and anger, which are also symptoms of depression, but someone might not pick up on those as necessarily symptoms of depression. So I wanted to also propose that as a possibility. Real quickly, for young people, I think one reason might be, again, their sophisticated knowledge of mental health and mental health counseling might be contributing to the rise in the diagnosis of mental illnesses among them, and also the societal pressure on them, the expectation to look a certain way and achieve a certain way. I think social media is a big culprit in that regard, might also be contributing to the rise in mental health rates.
All right, I see. It's quite interesting that we need to consider gender difference when seeing the data. Now, Dr. Chu, up until now we have been talking about mostly adults, but adolescents are not an exception in terms of mental disorders. And the data from the National Health Insurance Service says that the number of adolescent patients has increased by an average of 65.5% over 5 years up to 2022. Now, what is making the youth suffer so much?
Yes, it is problem, and several factors probably contributed to increase in prevalence of mental health disorders. One is that adolescents are facing intense academic competition and pressure to excel in academics, and this age has been lowered to even like kindergarten age, and probably this pressure and stress have accumulated over time, and in adolescent period they show up as a mental health distress or mental health symptoms. Another factor that may contribute to mental health disorder is social media use. It is quite a complex impact, but the negative impact it has on mental health can include social comparison. Teenagers at that age tend to make constant or frequent social comparisons, and social media provides that platform for social comparisons. And seeing idealized celebrities or peers in social media can lead teens to feel relatively inadequate and experience low self-esteem. Cyberbullying is another problem that occurs in social media and can negatively impact mental health. And despite these negative impacts, teens feel afraid or they cannot stop using social media due to fear of missing out. And this can lead to increased screen time and resulting in less physical activities and less face-to-face interactions, which also negatively impacts mental health. Another reason that may have contributed to increase in mental disorders among adolescents is a bit more positive, which Dr. Kim also mentioned earlier among adults, increased mental health literacy. Teens these days have higher awareness on importance and types of mental health issues, and therefore report it to adults and seek help for their symptoms, which have led to increased reported cases of mental disorders.
All right, I see. It's quite interesting to see how social media and internet could be certain reasons why there is an increase in the adolescents' mental illness cases. Now, Professor Kim, staying on this issue, the type of mental disorder differ depending on gender. Female adolescents suffer depression and other anxiety disorders more often, while boys suffered more from ADHD and tic disorders. Why the difference?
What you're highlighting there is that social cultural context matters when it comes to the experience and expression of mental illnesses. As an example, ADHD is a disorder that you mentioned, and when you think about the key symptoms, especially the external symptoms of ADHD, research indicates that for girls, their restlessness, which is a symptom of ADHD, might not be picked up on as much or underdiagnosed compared to boys who might experience things like behavioral disruption that are more readily picked up by clinicians and those who are diagnosing. And so one sort of explanation that could capture the gender differences in the various disorders would be the social cultural context influences both the experience but also the expression of mental illnesses.
All right, I see. Now, Dr. Chu, I saw some of the reports saying that one of the reasons why youth mental health is not properly being dealt with is because there is no control tower and responsibility is dispersed across various government agencies. How is this issue of youth mental health currently being dealt with, and how should it be improved in your opinion?
Yes, it is one of the problems, although I appreciate the government's effort to provide various mental health support for adolescents, such as 청소년 상담 복지 센터 or 청소년 사이버 상담 센터. There are problems because there's no one integrated control tower to support adolescents' mental health. One of the problems is that many of these services that are provided overlap, potentially causing confusions and delays to getting help at a right time. For instance, teens seeking a crisis hotline can search on Naver for suicide hotline. He or she or the student will likely find at least 5 different channels for suicide hotline. And all these 5 channels sound very similar, and it's difficult to distinguish which hotline the teen should reach out for appropriate help. And second point is that these services and outreach support often focus on post-pension, which is that mental health disorders or problems occur, and then they intervene to reduce the impact or recover the impact of mental disorders. But they need to also expand to having outreach program for prevention programs, including helping students learn how to cope with stress and anxiety. And this can empower students to reach out to the right resources at the right time. So they need more integrated support services and also extended area of support, including prevention, not just postvention.
All right, can I agree more? It seems there are many reasons why we need an integrated control tower to deal with the issue. Professor Kim, we have been talking about adolescents and adults, but I'd like to ask you about the mental health issues among elderly population. How is it?
Like adolescents, elderly population is a vulnerable group. Some of the more common symptoms or illnesses that they experience include dementia, depression, and anxiety. When you think about the risk factors for the elderly population, they might include things like economic difficulty, physical illnesses, social isolation, and things like substance use. And what's really important for working with elderly population is to have culturally sensitive therapists who might be able to speak the language that's understandable to the elderly population. And by that, I mean, when it comes to mental health concerns, using terms and phrases that would be understood by this group who might not have familiarity in talking about their emotional concerns, at least not as much as their younger counterparts.
Right, I see. Now, Dr. Chu, knowing what mental issue one is currently suffering from is of course important, but what also matters is, of course, treating the condition properly. However, according to a report released by the National Center for Mental Health, only around 12% of people diagnosed with a mental disorder in South Korea have consulted with an expert. How low is this figure compared to other countries, and is there a specific reason why Korean people do not visit mental health clinics?
Yes, as you mentioned, it is relatively low rate compared to other developed countries. In the same report, the US showed 43% people visit experts after their diagnosis. Japan also reported 20% visit experts after their mental health diagnosis. I think several factors contribute to this low rate. One is lack of awareness of importance of seeking evidence-based treatments. I think there has been increase in awareness of importance of mental health and seeking help, but still insufficient awareness about it is important to seek scientific research-based, evidence-based treatments. People sometimes solely rely on like religion or even shamanism to treat their mental health issues, but there are professionals like counselors, psychiatrists that can provide evidence-based support. The second reason, I think, is the stigma that is still associated with seeking professional mental health support. People still often think that receiving help from professionals means signs of weakness, or it can mean that I have some crazy, very big problem. Another stigma or worry that is a barrier to seeking experts' help is that people worry that the diagnosis or results of receiving counseling will be released to school or work and impact their grades or performance. But all these services that you receive from mental health professionals are confidential and will not be released. The third reason that impacts this low rate is, I think, the cost of receiving this professional support. In the US, many insurances cover counseling and psychiatric services that they receive. But in Korea at the moment, national health insurance does not cover psychotherapy or counseling services. And these are quite costly if you need a long-term treatment. Government sometimes provides subsidies for certain populations, but still that's limited to short-term counseling, which is up to between 5 to 10 sessions, and definitely not enough to receive long-term treatment. Therefore, I think these factors need to be improved in order to help people seek help from the experts.
Right, I see. And to tackle this issue, we could easily think of a way to raise public awareness to let people know that there's nothing wrong to visit to mental health clinic and get the consultation. But Professor Kim, what other measures do you believe need to put in place for people with mental disorders in order for them to get proper treatment?
I think barriers should be dismantled. And when I say barriers, I mean 3 different levels at least. So the first barrier might be cultural or societal barrier. Are there public beliefs or cultural beliefs in Korea that might contribute to hesitation about seeking services? I can think of, for example, shame being a big factor. There's also interpersonal barriers that we can think about. In other words, for example, does my family approve of me going to a professional counselor? If someone considers the family to be an important part of who they are, then their opinion about seeking counseling really matters in their individual decision. And finally, there is within the person or intrapersonal barriers. And that, I would say, is internalized stigma of public messaging and others' messaging about seeking services. And psychoeducation, as Dr. Chu noted, is really important in order to destigmatize mental health in individuals.
All right, I see. Now, we are running out of time, but I'd like to ask this very last question to our Dr. Chu. The government plans to announce the National Mental Health Service Innovation Plan in the near future. What do you think should be included?
I think, as we repeatedly mentioned, reducing stigma of receiving mental health support and also awareness on importance of mental health is necessary, and it should be included in this new proposal. And I think also there needs to be more effort on preventing mental health illness, such as like outreach programs on raising mental health issues, also developing coping skills so that people can cope with daily or academic stress regularly. And this can also include building resilience in order to prevent mental health distress.
All right.
And I think efforts such that you do in Arirang.News, promoting Mental Health Awareness Day and discussing social issues can contribute significantly to improving Koreans' mental health.
All right, thank you for saying that. Well, I hope those who are suffering from mental health conditions can get adequate treatment without facing any discrimination or difficulties. Well, unfortunately, this is all the time we have for today's edition. Thank you, Dr. Chu and Professor Kim, for your time and insights. We really appreciate it.
Thank you for having me.
Thank you. All right, that's all for Within the Frame tonight. We'll be back tomorrow with more in-depth stories. Thank you for watching, and goodbye.